Hello, my name is Lindsey and I'm currently working on my master's degree in health system administration. Before I started my degree, the opportunity to study abroad was not something I thought I would ever get the chance to experience, especially within my degree field. When presented with the opportunity to go to Sweden to learn about their healthcare system, I was incredibly excited. I knew that this experience would not only enable me to have a more global understanding of the overall healthcare environment and competitive marketplace, yet I knew that I would also be able to learn and employ some of their best practices in my current health organization. I feel it's important to give you a brief overview of Sweden's healthcare system. So with this, they are ranked as one of the best in the world and exemplify best practice in many different areas. This is because they have better patient outcomes at a lower cost. They're different than the United States in that they're a universal healthcare system, which means that all people and communities can use the health services that they need. The country's strong partnership between the governmental bodies and healthcare professionals helped them to be successful in delivering high quality and economically viable care. With COVID-19, we were unable to undergo the true study abroad experience, but we were incredibly fortunate to have the ability to partake in a virtual program instead. We were able to meet and interact with a variety of different Swedish healthcare professionals that taught us everything from the historical and social development of their system to its governance and financial structures. While primarily lecture-based, each facilitator allowed us to ask as many questions as we wanted, provided us a wealth of information, and several of them had us participate in group activities that broadened our understanding of their system and the major differences and challenges that each system faced. Throughout the course, it was becoming more apparent that a lot of the country's success was due to their innovative culture. Innovation is vital in healthcare as well as a leadership trait, as new ideas and technologies can completely change the healthcare experience and delivery model for patients and providers alike. This idea dovetails into our group project work to develop a pitch for an innovation of our choice that would solve or alleviate the impact of a healthcare problem. My team selected to tackle teletriage in the setting of the emergency department, with the goal to decrease patient anxiety, patient wait time, and decrease the number of people that leave without being seen. I know that our approach to this project would not have been the same had we not had the virtual study abroad experience. This experience allowed us to have a more global approach to our innovation, to think outside the box, and applied what we learned with what Sweden does with regards to their telemedicine platforms and see how we're able to make it work here in the United States. For instance, in the primary care sector, the physicians that we spoke to told us about an open arm approach practice that allows for open lines of communication from the patient directly to the physician in lieu of the telephone game that many of us are used to in the United States. With our innovation project, the idea of teletriage has a similar mission in getting patients in touch with the physician directly and quickly to address their needs without barriers. Another lecturer that helped us navigate the development of our innovation was a retired CEO of a long-term care facility. With 87% of care for the elderly being given at home, we wanted the ability to evolve the more traditional notion of a house call to a telemedicine version. This would be one of the great advantages to check up on those that may require care and attention, while allowing them to have that care and attention from their own home. This notion would also align with the Swedish values and commitment to allowing their elderly to live as normal and independent lives as possible by giving them the support and tools necessary. All in all, I cannot speak highly enough about the virtual study abroad experience. The idea of remote travel experience brought about some degree of anxiety and uncertainty. I was unsure how the course would go, and I was afraid of missing out on some critical components. Yet after the first Zoom, these feelings dissipated. If you have the chance to do a study abroad course, please take it. It's a once-in-a-lifetime opportunity to learn about different cultures and perspectives, enhance your network, and even learn something new about yourself.